Hello, everyone. It's August 24th, 2020. I've got to tell you that today is always a tough day for me because this was my dad's birthday. And my dad died at a young age, 68, and on a very peculiar circumstance, but I can't tell you how much I miss him and how much I love him and just think about him and how much of an impact he had on my life. So I'd ask you to say a little prayer for my dad today too. But also today we've had multiple deaths again that I need to report to you over the last couple of days. We have now gone from 170 deaths to 179. We've lost our 171st death was an 84-year-old female in Logan County. Our 172nd death was an 86-year-old female in Logan County. 173rd death was a 78-year-old female in Logan County. 174th death was a 72-year-old male from Cabell County. 175th death was a 79-year-old female from Logan County. 176th death was an 85-year-old female from Logan County. 177th death was an 83-year-old male from Mercer County. 178th death was a 92-year-old female from Taylor County. And the 179th death was a 59-year-old male from Lincoln County. Now in this we had 5 deaths from Logan County. We had another death in Mercer County and Taylor County, Lincoln County, and Cabell. We all know that where the most vulnerable are, and that's in our nursing homes. And we all know that, to just tell it like it is, we brought a lot of this problem back on ourselves when we visited Myrtle Beach and different places out of state. But nevertheless, it is what it is. It doesn't really matter how. I always remember in the game of golf that that I was fortunate enough to play a lot when I was younger and everything. In college, I'll never forget somebody saying, "It doesn't matter how; it just matters how many." And in this situation, it doesn't matter how. It's just very simple that we are losing people, and they're great West Virginians. So please keep them in your thoughts and prayers. And some way we're going to get past all this. From the standpoint of our numbers, in the past 24 hours, we only had 40 positive new cases, and that's really good. Over the weekend, we had a total of 102. That's probably pretty good too. Our daily positivity number is at 1.70. That's really good. The active cases have dropped down some from 1,756 to 1,748. We've come down from that 1,900 number. We've come down a little bit on those that are hospitalized from 146 to 141. We have surpassed the national average from the standpoint of testing, where we're up to 21.6% of our population tested. But in that number, we should remember just this, and that is we have retested people to some degree. So that number is a little inflated from the standpoint of 398. That number is probably inflated to the tune of 50 or 60,000 tests. And so we're not quite as good as that number that I'm reporting to you. One thing that's really, really good is our RT number now is at either 8.5 or 8.6, and Dr. Marsh will talk about that in just a second. But it's tied for the 3rd best in the nation right now, so that's really good. From the standpoint of our map, as far as how we've color-coded the counties and all that kind of stuff, we now only have 1 county in red, and that is Logan County, and only 1 county in orange, and that is Monroe County. So we're hopeful to get all the counties out of the red and the orange, and we're working that way, but I congratulate the good work that's been done by lots and lots of people, and push and encourage them to stay after it in every way. Now, along those same lines, and I'm kind of jumping around here just a minute, but Jordan, if you could put the map up, the thing about when we mandated our face coverings and everything, if you could put that up and everything. Just look at this just a second. And this you've got to be really proud of, again, West Virginia, is that on July the 7th, I made an executive order to make it mandatory that we wear face coverings indoors when we go outside to an indoor facility, whether it be a Walmart or any kind of shop or whatever it may be. When you go in a building, you're supposed to have a face mask on. Well, there was some that pushed back, and I understand, and I'm not being disrespectful in any way to anybody, because, none of us like this mask deal, and so we pushed back a little bit, but yet, for the most part, overwhelmingly, West Virginia, you stepped up and did exactly what the executive order was to do. And look what's happened. When that happened on July the 7th, we knew we were in trouble. And we continued to get in worse trouble for a period of time. Now, there's two lines here. There's a yellow line and a blue line. And the yellow line is a 14-day average, and the blue line is a 7-day average. So naturally, it's going to take more for that average on 14 days to really kick in. But you see what's happened? You see exactly what's happened. In either line, when we made that order, we were going through the roof. And that order saved a ton of lives. That's all there is to it. Write it down. It saved a ton of lives because of what you did, West Virginia. You listened, you put those masks on, you absolutely wore the mask, and you did great with it. And look what has happened. Look how we have declined in our daily positive rates. Look how it's gone down, just boom, 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 boom. It's because we took action and you did exactly what you should have done. So you did good there, West Virginia. Thank you so much again. On our long-term facilities that we have, well, I want to say one other thing. We only have one county today that's in the orange and one county in the red. And we're gunning toward a September 8th opening, and it looks like we're going to have a lot of kids come to school on September the 8th. Now, from our teachers, our service personnel, our kids and everything, is it going to be perfect? It's not going to be perfect. Is there going to be a situation to where we have some level of outbreak that happens somewhere in a third grade, a first grade, an 11th grade? Is there going to be something that happens? Well, sure it is. It's happening every day, and it happens every day across this state. We manage it. It won't be perfect, but it will absolutely be to the very best of all these experts' ability, and they've done a great job, and so we really look forward to being back in school on September the 8th. From the standpoint of our long care facilities, today we have 31 outbreaks, and the largest active outbreaks are in Grant County, Grant Rehab and Care Center, in Kanawha County in the Cedar Ridge Center and the Marmet Nursing Home, in Logan County in Trinity Healthcare, in Mercer County in Princeton Healthcare Center, in Monroe County in Springfield Center, in Raleigh County in the Pine Lodge Nursing Home, and in Taylor County in the Rosewood Nursing Home. Those are the largest and everything. We got to watch that some way, somehow, this doesn't continue to be like a can of night crawlers where we get one fire out as best we possibly can and then another one breaks, because getting the fire out usually entails just this, and that is just there are people, significant amount of people that recover, but getting the fire out is not good, because what happens all the time is we lose some good West Virginians. And so we've got to some way stop the fire from happening, and that's what we're trying to do. We have 3 active outbreaks reported in churches in 3 counties now. These total outbreaks are a total of 33 cases. That's down. They're in Cablewood in Wyoming County. You know, they change from time to time just a little bit. So from that standpoint, we're continuing to have outbreaks in different counties. We got to be really, really careful, and we got to keep doing exactly the good stuff that we're doing at the churches. And that is, you know, from the elderly standpoint, I encourage you, if you can get service online or whatever like that, you know, you may want to think about that. And if you go, please, everyone there, have a mask on and keep the distancing between you. And we're going to keep pitching decent and good numbers. From the standpoint of our corrections, at Mount Olive saw new cases among both inmates and the staff last week. Corrections did what they've been doing over and over, and that is run to the fire, testing the entire medical section. And one of the housing units, there were more than 200 tests that were done. All the medical unit testing came back negative, which is great. The housing unit was still not back yet because it was just done on Sunday. All the remaining employees will be tested on Wednesday. As of Sunday, there were 3 inmate cases and 7 employee cases at Mount Olive that were positive. The South Central Regional Jail remains on lockdown after the second round of testing of enhanced testing there. And as corrections reported last week, there were more than 460 inmates and 80 staff tested at the jail. As of Sunday, there were 60 inmate cases that were positive and 4 employee cases positive at South Central. From the standpoint of our small business grants, all that's going along just great. We've now awarded and submitted to get out the door $10.4 million. It's finally moving up dramatically. I want again to tell all the sole proprietors and self-employed persons you can apply for up to $2,000 in grant funding. Get online and apply. We continue to push and encourage any and everyone to get after it and continue to apply, and we'll get that money out the door. You know, this now, you know, before we were telling you got plenty of time, no problem, just take your time, or you can apply quickly if you need be and all that kind of stuff. But now I'm telling you that your due date or deadline date rather is, I think, the end of September. I don't know exactly the date, but I think it's September the 30th. But you've got to hurry now. If you're going to apply, you've got to get with it. So from the standpoint of our cities and our counties, I just spoke to a mayor this morning. He said the CARES money has saved his city, and which is great stuff and all that. But we've sent out almost $88 million to 178 cities and counties. We can't award the money if you don't apply. And so you got to apply, and you got to, we got to fall into the guidelines. But I think that's going just great. We all know that, it came out that we were getting that money out, in a really expeditious manner. And I commend all the people that have really worked really hard on that. Oftentimes I don't mention J.B. McCuskey enough, but he and his staff have done fabulous work along with so many that have, been able to get monies into individuals' hands. Our free testing is going on this week in Boone, Lincoln, Mineral, Mason, and Webster counties. You'll see that all up on the screen. I encourage especially our minorities to go and be tested. The more we test, the more we learn. You've heard that till you're blue-green. And so from my standpoint, all I can say is if you have any anxiety, you have any symptoms, you have any just want to go get tested, it is painless as it can be, and it won't take but a second, and maybe it'll alleviate a whole lot of worries and everything else, and it surely will provide us vital information as well as yourself. I want to again say we don't want a West Virginian going hungry, period. And if you have any reason that you need some assistance, we got 696 spots. You know, the agricultural people are doing a fabulous job here. I commend Kent Leonhardt and all the good stuff that they're doing. But if you need some assistance, you call 211 and we'll come to run to the fire there as well. Because we don't want one person in the world going hungry. And I want to encourage all that to do anything and everything you can to continue to donate to our food banks, and because it's just good stuff. It's great stuff. I want to talk to you again about the census. We were at 84.5%, and we were at second in the nation as far as the people that how we'd been counted. I want to thank so much all those team leaders, street leaders, community leaders for helping me get our people counted. But now listen, we're in a race now, who's going to be the best? And we're in a race with the Idaho Taters. And we absolutely don't want the Taters to beat us. Now, come on, we got to get counted. And so, team leaders, anybody that's not been counted, help us. Help us push this over the top where we'll be the best of the best. Because every time West Virginia is the best, it just rubs it in the face of everybody else in the nation. And really, it just makes West Virginia just look better and better and better. So just keep trying, and let's get this over the top. The only other thing I've got to report today is just this. You know, we've lost 179 great West Virginians, and please keep them in your thoughts and prayers. And we're on a glide path now to start back to school. We're going to only do it as if we can know that it's as safe as we can possibly make it. And absolutely, you know, we're going to do it with the choice that parents can decide, you know, if they want their kids to come back or not. You know, we're doing it from the standpoint of, you know, virtual or a hybrid of that, or in class, teaching. You know, I commend our teachers, all those from our superintendents that have put these great plans together, to our state superintendent, you know, Clayton Birch, or to our great state, you know, board and everything that Miller Hall's heading up and everything. And so I think we as West Virginians continue to move in a positive way. You know, you continue to work really hard from the economics of our state and the well-being of our state financially, and we're trying with all in us to protect our state, you know, from the standpoint of this terrible killer that we're going to have to live with until we get a vaccine. Now, if I'll end with just this, I'm going to end with just these, you know, the same graphs that you see all the time. If Jordan, if you'll throw that up. You see the top one now, it's still beginning to widen, and that's really great. That's what we want. We want that thing so far, you know, apart that we can't even see the ends of it, you know, but it's doing what we want it to do, and the wider it gets, the better off we are. The second chart is our daily positives, and just look at how we're bouncing along below that line in the last few days. That's really, really, really great. And the other thing is our cumulative number, you know, is now at 2.34. It won't move down or up as dramatically and everything, but that number's still really good. And so I guess that's all I've got for today, but I, you know, again, I commend you for all the great work and hard work that each and every one of you are doing, and just keep it up, West Virginia. You're doing really good.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and it's really my pleasure to reinforce a few of the things the governor has said, and perhaps tell you a few things that I'm learning. So our RT value is tied for third in the country at 0.85. As you remember, it wasn't very long ago when we were the worst in the country or the next to worst in the country. So this can move very fluidly, and it's really important to recognize that it's not only the hard work of everybody who is in our state in taking care of themselves and their families and taking care of all of our families by wearing a mask and staying appropriately physically distanced and washing their hands. But also, as the governor showed, the executive order for mask wearing or face coverings has really made a dramatic and positive improvement. So West Virginia, keep that up, because we are venturing into the next phase of our relationship with the COVID-19, and that is the school openings, both at the K through 12 level and also higher education. We are getting some experience with higher education, and as the governor said, we are seeing some of the smaller outbreaks that we're all responding to very quickly, but that is just going to be a fact of life as we get people back in again. And the key is to keep that percent positive rate below 3%. And the lower we can keep that rate, and remember our gating strategy is 5%, but we really want to see it below 3% because it's much easier for us to continue to separate the people that are being infected and the people that are not and their contacts if our rate is low. And we either get to that rate by having a low transmission, which in parts of the state we are, but also a very high rate of testing. As the governor said, we are doing very good relative to most other states. Now, one thing to notice about the map for school reopenings is that if you look at the Harvard Global Health Institute and look at our state map, they're going to be slightly different. And remember, the difference in the two maps is the Harvard map counts all cases. That is community spread cases and congregate cases, including nursing home residents, correctional facilities, inmates, etc. And the West Virginia school map and map for other activities really just focuses on the community spread. So the maps are going to be different, but we have modeled the metrics and the approach using the incidence of new cases on a 7-day rolling average, and in the small counties, as we talked about, a 14-day rolling average, which is consistent with the Harvard map. But the difference really is the fact that Harvard looks at community and congregate spread. We just look at community spread. Now, two more pieces of information that I want to share. So number one is yesterday or today, I can't remember which, I think it's yesterday, the convalescent plasma, the immune plasma, which is a blood product that is used from people that have recovered from COVID-19 to give to people who are really sick with COVID-19, was approved by the Federal Drug Administration for emergency use authorization. And basically what that means is we will start being able to give the convalescent plasma, not necessarily using only a clinical trial, which we are part of here in West Virginia, but that will change the game because in people that are really ill in the ICU on ventilators, if the convalescent plasma is given in the first day or so, then the reduction in death is 36%, and that is something that's really significant. And although we haven't finished the prospective study, which we need to do, this is, I think, a real positive step for our armamentarium in helping treat our sickest people. As the governor said, we have a state of people that are very vulnerable. The last thing, which is something to give us a little bit of pause and thought. So yesterday was reported for the very first time in a way by a government and health agency that a gentleman in Hong Kong became reinfected with COVID-19. And the way that they did this is they measured the virus's genetics, and they were able to demonstrate that the initial virus, COVID virus, that this person was infected with, that gave this person some mild symptoms, was different than the genetics of the most recent virus that person was infected with. And that's not really a surprise to us because we know that COVID-19 is a coronavirus, and coronavirus are yearly viruses that infect people. So if you had a coronavirus last year, you still can get it this year. So we knew that the immune response may not be lasting, and this was about 4 months from the first infection. And we have known that antibody levels go down over 3 to 4 months in a number of people. So that really tells us, though, that if you've gotten COVID-19, then you may well be protected against a more severe form again, but it doesn't completely protect you from getting COVID-19 again. So this is a real warning for a lot of our younger people and people that may not consider themselves so vulnerable, because we know now that getting the disease is not necessarily a lifetime of immune protection from that. So thank you very much.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. A significant push again to continue testing. As was pointed out by the governor and Dr. Marsh, we continue to be exceptionally aggressive in our testing efforts. Since the 18th of August, the state of West Virginia has recorded an average of 6,000 tests a day. We hope to continue to keep a significant pace. And as the governor pointed out, we are at or exceed the national average in percent of total tests per population. Sanitization missions are continuing to ramp up, working with the corrections facilities as well as our nursing homes and other facilities. We've also continued to work with our first responder community to help address outbreaks in police and fire agencies. Also continuing to work with Department of Education on securing the appropriate amount of PPE for the upcoming school year, as well as working the Wi-Fi hotspot issues and expanding out into our armory locations where viable and possible. We also, as Dr. Marsh pointed out, the governor had authorized us to procure issue funding to procure the capability to store convalescent plasma, and that initiative is ongoing at West Virginia University currently. Thank you.
Thank you, General. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. A little over a week ago, Governor Justice signed an order restricting visitation to nursing homes. Again, we've had multiple outbreaks, and in an effort to be very cautious and make sure that we had a process going forward, we worked hard last week with the Healthcare Association, the Association for the Nursing Homes, to develop a system whereby there was guidance with regard to those openings, those facilities who could allow visitation and who could not. We talked about the county alert system, which is now on our dashboard daily and updated daily. That county alert system will not only be an alert system for education, the Department of Education will also be an alert system for nursing home visitation. So happy to announce that the governor will be signing an order rescinding the previous order so that their visitation will be allowed. That should be effective at midnight tonight. Nursing homes then can use this guidance in going forward. Counties that are red will have restricted visitation. That visitation will restrict all activities, will restrict communal dining and non-essential services. Phase orange in this plan allows compassionate care visitation only, some facility activities, communal dining, and not essential services. So when a county is yellow or green, visitation will be in green, certainly unrestricted. But again, I urge everyone to contact your local nursing home and arrange for those visits during this pandemic. So I want to thank the West Virginia Healthcare Association and the nursing home providers for assisting us in the development of this. Again, we're pleased to roll that out and make sure we allow loved ones to get in and to see their family members.
All right, thank you both. We'll now go to questions from members of the media. Our first question today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to ask you about laptops and tablets for school children. When you announced the Kids Connect program, you said the state would also be providing any computers that kids needed. Has that been done, and has that been ready for the beginning of the school year? Thank you.
Charles, Superintendent Birch is not here today, and he's not on with us, and so I don't know exactly where they are on that progress, but but I know they're working it, and they will absolutely achieve exactly that. But it'd be unfair for me to try to speculate on exactly where they're at, because I don't know exactly where they're at on that.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, I want to address something that people have been bouncing off of me on social media and calling the station. At what point do you wonder or worry or are concerned that you may start losing people from the sheer redundancy of the message as we continue moving forward with no vaccine and we're in a status quo? How do you keep people energized, engaged, and actively protecting themselves and others when we see basically we're in this Groundhog Day situation, in a manner of speaking? And as we move into the fall, where people like Dr. Marsh have said that we can expect this thing to kick up again, and we will in some ways be back where we were in the beginning, obviously armed with knowledge, but certainly dealing with what they expect to be an increased number of cases. How do you guard against that?
Well, Kenny, let me just say this, that West Virginians have done a great job in guarding against it and listening to date. Is it always a concern? Yeah. Do I feel like a big giant cheerleader a lot of times? Well, of course I do. But just think about this. You know, when we've gone to these briefings Monday, Wednesday, and Friday, I oftentimes think just this is, you can't fathom the information that that we have to present when we take a day off, when we're not taking a day off from our work, but a day off from the briefing. So if we don't have a briefing on Tuesday and we come in on Wednesday, the amount of information is unbelievable. And I say it all the time. I used to say, I can't believe that I come in every day and the amount that is to present every day. But when we take a day off and then come in, the amount of information is very significant. Now, to better answer your question is just this. Think about what they did in Georgia. What did they do in Florida? What did they do in Arizona and Texas? People got asleep at the switch. And really and truly, before they knew it, they've got a tsunami right in their back door like they can't imagine. What happens in West Virginia if that happens here? Do you not really think that in Florida and Texas and Arizona, they have more medical centers, bigger centers that are really able to handle people and do things easier than our community hospitals? And so what happens if we throw this tsunami right on our community hospitals? And so, in other words, it may be redundant, Kenny, but this is exactly what my job needs to be. I need to come here and tell our people just how significant it is that they are on guard and on guard all the time. Vigilant, on guard. Because if by chance we become a Texas or a Florida or Arizona, we're not going to be able to control it. So many will die, it will be unbelievable. And that's the very thing that has driven every single thing that these great experts, all my people, everybody that is involved in this, we know exactly just that. So yeah, it may be Groundhog Day. And yeah, we may get feeling redundant, and we may absolutely be concerned that people may go to sleep at the switch. But what do you do? What do you do? What you do is exactly what we're doing. Try to come, try to encourage, try to incentivize, try to motivate from the standpoint of just this. Think about this county deal. Does it not motivate our people in our counties that are yellow to some way, somehow get into the green? Well, of course it does. Does it not motivate from the standpoint that if you're in the orange, that you can't compete in sports and everything, that we can push you to some way, somehow, do anything and everything you can in that county to get yourself where you can compete? Of course it does. Now, so, at the end of the day, we come and we do our jobs, and that's what we're going to keep doing.
All right, thank you, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here. I'm going to bounce off Kenny's question a little bit. I'm going to try to do this in a way not to necessarily throw anyone under the bus, but obviously moving forward, something we need to think about in regards to the nursing homes, which with this new color-coded map that started off for schools, but looks like it's going to be used, and sounds like there's a good way of tracking that and trying to keep nursing homes safe. But obviously we put in plans in place back in April based on a handful of outbreaks at a few nursing homes back then too, and it didn't seem like some of the lessons that were learned back in April, and I'm not saying by the state, some of this is nurses going off on vacation or staff going off on vacation to Myrtle Beach or wherever and coming back. But what lessons are we learning in regards to how we enforce some of these issues to try to keep nursing homes safe? Because that obviously going forward, once it's been said on here before, once someone gets sick in a nursing home, it's lighting a match in a vat of gasoline. So going forward, how do we make sure we enforce some of these mechanisms to try to keep those nursing homes from becoming tender? Thank you.
Okay, Stephen, I love your question. I really do, because I want to give you again, I want to speak to you again from my heart. My heart is just this, and here's all there is to it. We listen to the different associations, we listen to the nursing homes, the medical community, and everything else. Now, you got a really tough situation here. You've got people in nursing homes that are elderly that desperately need to see their family. And you've got their family that desperately wants to see their loved one that's in a nursing home. And from my standpoint, I can tell you that I am tremendously concerned about moving to the color coding to be able to achieve that. Now, I want that to happen. I really want that to happen, but I can assure you just this. From the color coding, if by chance we have additional outbreaks because of visitation, then we're going to have to batten down the hatches and go back to no visitation. I am not really an advocate from the standpoint of going to the color coding and everything with our nursing homes to the magnitude that maybe our associations are, maybe our medical community is, or whatever. I'm going to watch it with all in me, and if I have to move back to no visitation, I will. From the standpoint of others that are, that can weigh in, not necessarily just on this, but the more broader question that you've asked of what things have we learned, I think others can weigh in on that, but my feeling about this is just this way. I know it's terrible. If my mom or dad were there, I would be wanting to see them so badly, it would be unbelievable. And it is vital to their life as well as our lives for our people to be able to see in person our loved ones. I get it. I get it wholeheartedly. But the other thing that I also get is this: hope and pray that we're not far from a vaccine. And if we absolutely can't do this safely, because you're dead on the money, right? When we get an outbreak in a nursing home, it goes like a brush fire, and absolutely we have people die. So I am telling you, I am very cautiously in agreement to be able to do this. But I'll pass to Bill, Secretary Crouch at this time.
Sir, Steve, that is a very good question. Let me talk a little bit about what we're doing right now and what we have learned. We've been, as I've said before, focused on outbreaks. We had a lull there for a while where nursing home outbreaks kind of slowed down and they were very small. We're now seeing larger outbreaks. We are developing strike teams. We've used a buddy system type of approach here in the past 2 or 3 weeks, and that has helped greatly. Again, we've had some private operators step up and offer to go to other facilities that do not have the resources of a larger corporation that has regional people to send in. So we've learned a great deal from that. Our next step is to develop teams that will go out, and we worked on this Thursday and Friday of last week, and Dr. Amjad and I spoke about that this weekend actually, and had some communication with folks. Those teams need to include physicians, and we've actually have a great group of physicians who have stepped up in terms of telemedicine to provide assistance. Dr. Amjad will be part of these teams, but we need physicians to actually see these patients as quickly as possible when we have an outbreak. We will include we have to have nurses in there, experienced long-term care nurses on these teams. We have to have our regional epidemiologists. We have to have our local health departments. And I mentioned, I think Friday, where we had a local health officer in Greenbrier County who actually packed up and took her PAPR with her and went into the facility in Monroe County, which is above and beyond her responsibilities, and actually sent nurses over. So I keep talking about working together. That's what we have to have here. But we are tapping folks to work on these teams so that we can have a group of experienced individuals who, when we have an outbreak, immediately get into those buildings and see if we can stem that outbreak. We've talked to our epidemiologist over and over. These outbreaks are just difficult to contain once they get into a building. So we're looking to see if we can do that, however. So that's our next step. What we've learned is we need some eyes on by medical folks fairly quickly in these situations, and we need a team of folks who can provide feedback for us. Thank you.
All right, thank you, Steve. Next, we'll go to Mark Curtis with Next Star Media.
Sorry, guys, I've been on vacation for a week. I'm all thumbs, but I enjoyed our state parks tremendously, Governor. Let me ask a question regarding food. I've had a number of viewers call me or email me wondering if the food cards that were distributed, I think they were $300 per child in early June on EBT cards to help feed children who are in school or working over the summer. Are those cards going to be reissued or reloaded again for the fall semester, especially for students who are going to be strictly learning from home?
Secretary Crouch, you need to give the information on that. You can do that the best.
Yes, sir, Governor. Yes, those cards are being reissued. Again, we've set those up so that purchases could be made online rather than in person to keep people safer who want to do that from home. So yes, we've extended the timeline on those, and I can provide those times possibly Wednesday. I have an update for you with regard to the specific dates on those, but we are certainly extending those timelines and moving those out into to those families as quickly as we can do that.
All right, thank you, Mark. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hello, everyone. Brad here. Governor, you talked in weeks past about an advisory committee of legislative leaders who were working with you on some of the financial considerations of all this, but I haven't heard about that group for a while. When was the most recent time? Who is on that committee? How often are the meetings? And for the public, should they be open meetings? Thank you.
Well, Brad, I don't know the legality whether it should be open meetings or not, but the people that are on the task force or the advisory force or whatever, have been leaders in the House and the Senate in both parties. So from the standpoint of there's about, I don't know, there's 8 coming from them, and then us and everything, and so. But we've met several different times, and we, and our people are talking, back and forth with them as well as I, but we've met several times, and we continue to do so, and we continue to solicit any level of input. If someone, whether they be just they be a delegate or a senator and everything, we encourage them, talk to their leadership, and then let the leadership bring us the ideas and the thoughts and everything. And we want to be an open door, open book, and take in as many good ideas as we possibly can, and that's what we're trying to do.
All right, thank you, Brad. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, Governor. Emily from West Virginia Public Broadcasting here. My question is for, I guess, anyone on the panel who has something to say on Logan County. I am just curious at this point, what kind of help or guidance exactly is the county receiving from the state, be it in-person assistance or instructions for handling outbreaks, their cases, whatever it may be?
Well, I'll let General Hoyer jump in and start off with this, and then our medical community, whether it be Dr. Amjad or Dr. Marsh, can finish it up.
Good afternoon. So the governor directed the National Guard to immediately go to provide assistance both to the nursing home facility as well as Logan Regional Medical Center and the health department. So we have National Guard personnel working along with DHHR personnel to support the contact tracing initiatives. We have National Guard nurse who is working in the office in Logan again this week, was gone last week for additional training. We had National Guard personnel, technical experts work with Dr. Amjad and visit both facilities and look at infection control and air handling and isolation capabilities. And we've also done several sanitization missions for Logan as well. And I think Secretary Crouch and Dr. Amjad could pick up on the balance of the things we as a state team are doing.
Emily, sure. We talked to the nursing home medical director as well as her administrative director as well as the health department daily. We have also sent a PAPR down to the medical director. The National Guard helped with that, so she'll have that today. But we speak with them really every day to see what other needs they have. They ask for medical equipment to deal with the COVID unit. So medical director down there has asked for those types of equipment. We also, as far as the strike team goes, which Secretary Crouch mentioned earlier, we've also sent them those types of assistance. I spoke with the medical director over the weekend several times. Several of their staff is also sick with illnesses, so they need some additional staff, which we're going to discuss. But going along those lines, we're in contact with them daily, the health department, the different facilities down there for their needs. But we're on a constant daily talk with them through the National Guard as well for their assisted needs.
All right, thank you, Emily. Next, we'll go to Paul Mullen with WCBC.
Good afternoon. Good afternoon, Governor. Good afternoon, everyone. I want to go back to a one-child type question and see an impact and what it may have on an individual school. If you do have a child test positive in a school, obviously that is not going to necessarily have a big impact on a 7 or 14-day average and cause a shutdown. But would it cause a shutdown of an individual classroom, a school? How would that be handled?
Okay, I think Dr. Amjad and we'll start with you and Dr. Marsh, can chime in and let's see what we can get through this. Okay.
Okay, sure. If there's one child in a classroom, we have to go back to the local health department to investigate that. So depending on where the child was in the classroom and their contacts, but we initially start with the local health department to do their contact tracing. But that's where we would start initially with the local health department to conduct contact tracing, and then we would go from there. So that's the initial steps.
And maybe I could just add just for another small piece on. So I think that the question's a good one, and if we have a positive child in a room, as Dr. Amjad said, we would remove that child from the classroom. But it would be very likely that we would send the classroom home, and maybe even more depending on the interactions, for a couple of days as the local health department starts to understand who connected with who and who has significant exposures, so that we could do a more sophisticated contact tracing. But in the interim, I think we would ask the classroom at the very least to probably stay home for a day or two as all that gets done.
To me, just one second. I want everyone to understand just this. Going back to school won't be perfect. It just won't be. We'll definitely have, situations that we've got to deal with, whether it be isolate one classroom or send that classroom home or whatever it may be. This is not going to be perfect. That's why we give you choices. We say, parents, if you are absolutely, so concerned about this that you don't want to send your children to school, don't send them to school. But we've tried to make it as safe as we possibly can for the teachers, for the service personnel, for the kids and everything. And we feel comfortable with the fact that it will be safe. Now, will it be 100% no risk guarantee? Of course it won't. But just think about this, parents. Think about this, teachers and service personnel. When your kids are out and they go to Billy's house next door, when they go to Walmart with you, or where you go to Walmart with you, it's none of it can we completely remove the risk until we get some level of vaccine. But really and truly, today, we feel like we're going to have, with the great work of our county superintendents and everything, we think those schools are going to be a safe haven. And we know all the kids that need so badly to have one-on-one contact with some adult, to where that caring adult can look into their eyes and see their problems and try to assist in every way. I mean, whether you be at a pool party or a ball game, a Little League game, or Walmart or wherever, or sitting here just like I am right now, this thing is still with us. Will it not be perfect? Of course it won't. It absolutely, of course it will. It will not be perfect. But we'll watch with all the great eyes that I have around me and everything, and we will try in every way we possibly can to make it 100% safe. We won't achieve that, but that's what we're going to shoot for.
All right, thank you, Paul. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hey everyone, it's Taylor with Herald-Dispatch. I was wondering if someone, maybe Dr. Marsh, could speak to what it might look like after there is a vaccine. How much precaution will we still be needing to take? I assume nursing homes will still need to be taking lots of precaution even if there is a vaccine. Just kind of what will the landscape look like afterwards?
So that's a really interesting question, and one that I would answer with only speculation. I think that as the vaccine gets ready to be rolled out, the first issue will be around prioritization of who would be the folks to get it first. And at least as far as I have read, and what makes sense is that, frontline medical personnel, first responders, emergency workers, and people that are the most vulnerable may well get the vaccine first. As the vaccine continues to roll out, then there will need to be a very coordinated plan, of which I know that the governor's office, National Guard, DHHR are already planning to come up with a distribution plan for getting people immunized. I think, like everything else, one of the issues is that some people may be hesitant to take a vaccine just because of the concern over vaccinations. But this is an episode, an incidence that really tells us the power of vaccines and vaccination, as other than clean water and clean air for people, has probably been the single most important public health measure to improve the health of our world. And today our world is as healthy as it's ever been. So I think that as we go, the other thing that will be important is for us to keep track of not only titers' response to vaccine in selected people, but also, as we talked about today from Hong Kong, that the communication that while a vaccine may protect you, and the same for a flu vaccine or a pneumonia vaccine, it may not prevent you from getting infected, but it may very well lessen the severity of the infection if you would get it. So those are the things that we would start to think about when we do have a vaccine and when that vaccine is distributed for immunization.
All right, thank you, Taylor. Our next and last question today goes to Phil Kabler with the Charleston Gazette-Mail.
Always happy to bring up the rear. Governor, this was regarding the buzz on social media over the weekend regarding the small business $5,000 CARES grants that they've gone out to facilities, including vape shops, video lottery distributors, tanning bed operators, country club, a homeowners association at Snowshoe, and a nudist resort. And are we vetting these grants to make sure we're using the taxpayers in the highest and best way?
Well, Phil, I really don't know how to answer. You know, from the standpoint of you know, my feelings of how you report. Are you a journalist? Are you really a journalist, or are you really the campaign headquarters for Slango? You know, I think about, you know, when you came out and degraded people that were working at the Capitol and really made fun of their deficiencies. When I think about really and truly you coming out and basically attacking our foster children of all things after you got suspended from your job for 2 weeks and almost lost your job. And I think about what I did, you know, when I came out and said we should forgive. You know, probably, to be perfectly honest, if I would have just beat on it, you may have lost your job. But the net of the whole thing is just this, is I'm so glad I'm not Phil, you know, and really, but I think about the owners of your employers. You know, I think about how good a people the Reynolds family are, and Marshall Reynolds, what a wonderful, wonderful man. And, you know, and I just think, you know, for crying out loud, these are small businesses, and we got people that are vetting, and we're handling stuff from trying to look out after our nursing homes to handling billions of dollars of transactions and everything else. And we got people doing unbelievable work. And your column on Sunday says, well, they tweak this, they tweak that. Well, what on God's earth do you really expect people to be doing? You're insulting the Department of Ed, you're insulting, you know, the great medical experts, you're insulting all these people that work night and day and everything to be able to do this job and to deliver as they have delivered. And you want to come up with some, you know, my gosh, this is like you've got a tsunami and a nuclear attack, and you're saying, and your reporting is saying, well, Johnny didn't have peanut butter on his peanut butter and jelly sandwich. You know, well, I mean, really? You know, these small businesses that you know, to be vetted and to receive dollars, they've got to have employees, they've got to pay taxes, they've got to have losses because of the COVID situation. They're small businesses that are the essential center of our economy. And we got people that are vetting that through and through. Now, for crying out loud, if you're going to be a journalist, be a journalist. If you're going to be a writer for the Inquirer, then go on and do it. You know, but absolutely, I am so sick and tired of listening to your stuff that is so out there in left field, it is beyond left. And so, I don't know how to answer it any other way.
Governor, I'll turn it back to you.
Okay, if I could just end up by just saying this, I want to go back to, a great reporter and everything, and Brad McElvaney, but you asked a question in regard to the legislatures and the advisory council or whatever we call it that we got, formed and everything. And I want to tell you this, they've given us great input. We don't all meet together all the same time and everything, but constantly there's input that's coming from different members as to, what about this? Does this qualify? Does this not qualify? How does it all work and everything? Constantly. That's going on, and we welcome it. We welcome it in every way. We'll meet again, with the whole group real soon and everything, but I tell you over and over right now, what is the emphasis? I mean, just think about it just for a second. The emphasis right now is to try to stop our people from dying in our nursing homes and our populations that are just such as that. Our next immediate thing that I'm working on is this additional stimulus package that's coming down the pike, and trying to influence and do everything that I possibly can to see that West Virginia gets a seat at the table. That there's real dollars that come to us, additional dollars that come to us from a standpoint of our businesses that are suffering, or our cities or our counties, and on and on. And the other thing I would say, Brad, in regard to that is just this. Just think about how it has been handled. Why fix something if it's working? Now, we welcome all the input, just like I said. We welcome every bit of the input. But are the monies flowing to our cities and counties in a great way? And how we're rated on that, no question, whether we're second or fourth in the nation. I mean, come on. Are the monies flowing to our small businesses and everything in a good way? Have we solved the sole proprietor situation to our small businesses? We have. We absolutely isolated dollars from the standpoint of the unemployment, and just to ensure that we're not going to have our rates go sky high or go up, period, against our businesses and everything, because they're not. Because we put money over there to the side. We don't have a bunch of pet projects. I'm not going to let that happen. So really, at the end of the day, from the standpoint of what we're doing, I really truly believe that we're doing exactly the right stuff. And in regard to the grants, which exceed the CARES money, and are $1.4 billion, any kind of input that I get from anybody, I'm pushing them toward the grants and trying to help them with the grants and everything. But really and truly, Brad, from the standpoint, we welcome the knowledge, we welcome the opinions, we absolutely try to address each and every one of them and everything, and that's what we do, and that's what's going on right here and everything. But first and foremost, we gotta watch what's going on with these nursing homes. We got to watch that next stimulus package that's coming, and we got to continue to take as much input as we possibly can, and we got to make the right decisions, and we're doing that. We're making the right decisions, and we're making the right decisions with lots and lots and lots of help from the outside, from our medical team, our medical experts. We're making the right decisions from our education experts. We're making the right decisions from all the input that we're getting from legislatures. So that's what we need to keep trying to do in every way. Thank you all a bunch.